We are here with Christopher, who came to us for a particular problem, and we wanted to talk about that. And so, Christopher, what happened to you?
Well, I had a varicose vein near the surface on my right leg, near the ankle area, and I could see it bulged up, turned blue, and it was very, very close. I happened to nick it last summer, and it bled like an artery. I mean, the blood just shot out, spurted out. I had a heck of a time trying to compress it and get it closed. Didn't want to stop bleeding, but eventually I got it to stop, but there was a tremendous amount of blood. And then it happened again one other time. And so that's why I first got consultation with Dr. Schmetterer to take a look at it. And I had, to my surprise, a lot of varicose veins in my legs, and they weren't working properly. So getting those sealed off is a big help.
Mm-hmm. So as Chris, as we were talking, the problem is venous insufficiency, which is the valves in the veins are not working properly. Instead of blood going from your foot back to your heart,
Right.
It's going backwards. It's going down in the leg. And one thing that happens is congestion and pressure that builds up in those veins. It can actually weaken the skin on top of the vein. And if one of those breaks from either, women sometimes shaving their legs, men just, rough pants or walking through brush or whatever,
Sure.
those things can bleed quite a bit. And one thing I want to tell other people that might be listening, and we've talked about it, is if that ever happens again, and it's not going to happen to you because we've closed off all your venous insufficiency, so you are good.
That's good.
But if it should happen to anybody out there, you really don't need to go to the emergency room or panic. You just take one finger and you put that fingertip right on the bleeding site and get the leg up in the air. And if you can, you get somebody to help you and take a piece of gauze and kind of wad it up so it's, the size of like a $50. You don't want it all flat. You want kind of a lump of gauze. And you put that right on that bleeding point, and then you get somebody to put an ace bandage around that there so there's some steady compression, and kind of put your leg up in the air a little bit. And that's going to stop.
Okay.
You maybe check it every 30 minutes or so, and if I'd say after a couple hours, if it hasn't stopped, or some people are on blood thinner,
Mm-hmm.
and it's just almost never going to stop, maybe that's the time to go to the emergency room. But a lot of people can take care of themselves and get a good result. And of course, the next thing you got to do is come in and see me, and I will figure out the cause, and we'll prevent it from ever happening again. So you're in the midst of your treatment. How's it going?
It's going very well.
Okay.
I had a lot of venous insufficiency, as you mentioned, doctor, and it's getting taken care of. Went from right leg to the left leg, and I have a lot of confidence now, just a sigh of relief, I guess, less anxiety about that area bleeding now.
Good.
Because I was always worried after that, am I going to nick it again? Am I going to hit it?
I know. You don't have to worry.
Yeah.
That is sealed up.
Yep, and that's great peace of mind.
All right, buddy. Have a good weekend. We'll see you next week.
Sounds good. Take care.
All right.
All right, bye-bye, doctor.